Hi everyone, Dr. Kalaiko here, and we are now in October, which means it is Filipino American History Month. So today I want to talk about the contributions of Filipino Americans to our healthcare system. So have you ever noticed, if you've been in a hospital or a nursing home, that oftentimes many of the nurses happen to be Filipino? So how did this come to be? Well, it all started when the United States colonized the Philippines from 1898 until 1946. And during this time, the US government, along with Christian missionaries, established American-style schools, so elementary schools, nursing schools, and hospitals throughout the Philippines. And English was part of the required curriculum. Now, after World War II, the United States was experiencing nursing shortages. So according to the hospital managers, they believed that the shortage occurred because nurses were leaving the workforce to go home and take care of their families. Now, a lot of the nurses at the time were actually citing low wages and poor working conditions as the reason for why they left. So many of the hospitals and healthcare facilities decided to recruit nurses from the Philippines to fill the gaps. Part of it was due to their fluency in English, as well as their training in American-style nursing. Now, in 1965, the U.S. passed the Immigration and Nationality Act, which granted immigrant nurses the opportunity to petition to stay in the United States permanently. And at the same time, Medicare was passed, which meant that the demand for healthcare services was continuing to increase. So throughout the 1960s, all the way through the 80s, Filipinos continued immigrating to the US, many of them for healthcare jobs. So the reasons were, multifactorial. So part of it was higher wages. So they were able to earn higher wages in the US compared to what they would earn back in the Philippines, which would enable them to send remittances or money back home to their families. And many people during this time were also fleeing the dictatorship of Ferdinand Marcos. So according to Leo Felix Jurado, who's a professor and department chair of nursing at William Patterson University, without Filipino nurses, the US healthcare system would have been paralyzed, and it would have been almost impossible for the healthcare system to have safely existed. So in effect, Filipino Americans were helping to prop up the US healthcare system during this time of great demand and need for healthcare workers. But this whole phenomenon was not without a cost. So many of these overseas Filipino workers, or OFWs, they happen to be parents. So imagine being a parent and being separated by thousands of miles from your children and from your partner for years, or in some cases even decades. So, missing out on your child's, growing up and all of those milestones. At the same time, in the US, many Filipinos have faced exploitation and wage discrimination up to the current day. So historically and up to now, Filipinos are, placed disproportionately at hospitals and healthcare systems that are understaffed and under-resourced, especially during healthcare crises. So during the HIV and AIDS epidemic in the 1980s, some US healthcare workers publicly refused to treat patients living with HIV and AIDS. And we know that this contributed to the terrible stigma that exists to this current day around HIV. But that's a topic for another discussion. So Filipino healthcare workers migrated to help fill some of these gaps. Now, some American healthcare facilities have lured Filipino nurses with promises of higher pay, later forcing them to work long hours in unsafe working conditions, sometimes threatening to revoke their visas. In fact, in 2019, there was a human trafficking lawsuit in which 200 Filipino nurses alleged that the workers in a group of New York nursing homes were not paid the wages that were promised in their contracts, and they were forced to work in unsafe conditions with inadequate staffing. Now, fast forward to today, during the COVID-19 crisis, according to National Nurses United, as of April 2021, 24% of the nurses who died from COVID-19 complications were Filipino, but Filipinos only make up 4% of the total registered nurses in this country. So we know that this disease is disproportionately impacting Filipinos. We know that also several Filipino nurses have left retirement to help battle the COVID-19 crisis. So a lot have, making the decision to roll up their sleeves and come help their communities with this. And in fact, a common thread throughout Filipino culture is excellence. And the way that this shows up in healthcare is us striving to provide the best quality care possible at all times, sometimes at great personal sacrifice to ourselves. Many of us, in fact, treat our own patients like our own family members. And we know that Filipinos are not only nurses, many Filipinos work as domestic caregivers, as pharmacists, pharmacy technicians, physicians, public health professionals, health economists, professors, and so many other roles. And many of us are advocates for health equity and justice. So on this Filipino American History Month, I encourage you to reflect on the ways in which Filipino American healthcare workers have touched your life or the lives of your loved ones. Maraming salamat sa oras ninyo.